I wanted to take this opportunity to give you all some insight and information regarding my practice's experience with increasing access for our patients within our clinic during the postpartum period. In 2018, ACOG released a committee opinion with information from the Presidential Task Force on Optimizing Postpartum Care. And since then, the Florida Perinatal Quality Collaborative has put together an initiative known as the Postpartum Access and Continuity of Care Initiative, the PAC initiative, also aimed at encouraging and providing information for providers within our state on how to improve our patients' access to providers for their postpartum care. Prior to 2018, our practice was pretty similar to probably most practices and most providers in that we provided all of our patients automatically with a 6-week postpartum appointment. And then we would have certain subgroups of individuals, of patients who would come at perhaps 1 to 2 weeks postpartum. And those would be patients who had a C-section and they had a 1-week postoperative appointment, or patients who had a hypertensive disorder diagnosis intrapartum and they needed closer follow-up for their blood pressure. Since that time, since 2018, our group decided to provide all patients with a postpartum appointment automatically 1 to 2 weeks following their delivery, and then again at 6 weeks. The recommendations for increasing postpartum access to care have provided various schedules and suggestions for how to incorporate additional visits. And we chose this method to start out with the mindset that we could adjust and change depending on whether we felt that it was enough or if the timing was appropriate given our patients' needs. Seems like we hit the mark on the first try, and we have felt over the years that it has been a huge benefit to improving the care of our patients during their postpartum period. We certainly were concerned about whether or not this extra visit or this additional visit would bog down our already busy schedules, but we have found that it has provided significantly more benefit to the patient than harm to our office or our practice. We do have 4 doctors and 2 nurse practitioners within our private practice currently, and we do utilize our nurse practitioners for these appointments, but the doctors also incorporate them into their schedule as well. We have appreciated the improvement in diagnosing either worsening or new onset hypertensive disorders at that first 1 to 2 week postpartum appointment, which was certainly the primary gain and interest of the recommendation. And we've also appreciated many secondary gains and improvements in our patients' care with this additional visit, most notably our ability to efficiently and effectively diagnose postpartum depression and postpartum anxiety very early in their postpartum period and provide treatment. We do use the Edinburgh postnatal depression scale at both the 1-week and the 6-week postpartum visits within our practice. We've also been able to have earlier established contraceptive plans by initiating that conversation and ordering LARC devices if indicated, for example, at that 1 to 2 week postpartum appointment. Within our practice, we do not stock LARC devices. We order them individually per patient, and this gives us the 2 to 4 week ordering time to then be able to have the device for them and inserted quickly either at or immediately following their 6-week postpartum appointment, rather than waiting till 6 weeks to start the discussion and ordering of devices for their contraceptive plan. We certainly hope and will continue to work with the insurance companies as well as our state legislature to try to find a way to improve reimbursement for this appointment. It is clearly very needed. We have been able to prove to ourselves that it is very beneficial for our patients and meets many different marks for optimizing their postpartum care.